Welcome back to Taking Charge of My Cancer podcast, episode 64. Joining me today is one of my dear colleagues, Tarah Capozza. So Tarah earned her Doctor of Physical Therapy degree from USF School of Physical Therapy and Rehabilitation Science and Morsani College of Medicine in Tampa, Florida. Additionally, she holds a Bachelor's of Science degree in Human Performance from Florida Gulf Coast University in Estero, Florida. Her commitment to advance her skills led her to become a certified lymphedema therapist through the Academy of Lymphatic Studies. In her practice, she specialized in orthopaedics, oncology, and cardiopulmonary rehabilitation. Specifically, she addressed orthopedic conditions affecting the low back, hip, knee, ankle, shoulder, and neck. Additionally, she focused on impairments associated with oncological conditions, including breast cancer, head and neck cancer, brain, and lung cancer. Her expertise extends to the management of lymphedema and cardiopulmonary conditions. She's passionate about providing comprehensive care to her patients, tailoring her approach to meet their unique needs. Beyond her professional pursuits, she finds joy in staying connected with the latest advancement in physical therapy and this commitment to ongoing learning ensures that she can deliver the highest quality care to those who she has the privilege to serve. So Tara, thank you so much for being here with me tonight.
Thank you for having me.
Absolutely. So Tara and I go back into when she used to be my student just a few years ago. My God, that has been how long now?
10 years.
Oh my Lord. So 10 years and she has been one of my brightest students. So she really, I think that I've been doing oncology for 15 years. So I was kind of 5 years into oncology, so still learning a lot and just kind of really discovering a lot of the new onsets of the oncology world in physical therapy. So, but she was amazing to the point that, she is like, we need to keep her here on board. And so she decided to leave, right? So you left for like a year or so. You went, you got married, and then you'll tell us a little bit more about it. And then came back and then joined us for a little while, but I'm gonna let her just tell us the story for a little bit. So you wanna tell us about your mission and were you always planning to do this?
Right. So my mission is always been to help others and to positively impact all my patients in the physical therapy community in general. As far as my plan, I decided I wanted to be a physical therapist when I was a teenager. And then I kind of set my goals up for that, going on to pursue my doctorate degree in the end. In relation to oncology, it was my experience with you as a student that made me really enjoy the oncology realm and wanting to help those patients. So I knew when I graduated that that was something I was interested in coming back to. And I was so happy to get a job there with you guys.
Yes, so you wanna remind me how that happened. So you went away, you got married, and then you were working in a nursing home or something like that, right?
Yeah, so briefly in Tampa, I worked in a inpatient care at a nursing home. And then when we transferred up here for my husband's residency, I called you and everything lined up just perfect. And I was very happy to be a part of the team again.
Yes, yes. So she was part of our team for like full time, doing amazing. And then she decided to have a kid after kid after kid. So 3 babies now. And now she just works as a PRN for us, but it's always a joy having you here every time. We miss you to be here with us all the time because we love your energy and your driven and your passion. So hopefully those kids grow up fast and you come back and give us a few more hours of your joy being with us here working. So,
You darling.
so what good resources would you advise patients to look into if they've been diagnosed with cancer?
Sure. So one of the good places to refer patients to, I'd say, is the American Cancer Society website. There's a lot of resources on there for patients to use. And also from the physical therapy perspective, the APTA has an oncology website, which includes some good resources for patients also. So those would be the two places I would advise people to look into.
Perfect. And you have any 3 valuable tips that do you have that could benefit my audience?
Yeah, so my first tip would be if you've been diagnosed with cancer and you know you'll be needing surgery, is to ask your provider to refer you for a pre-op physical therapy appointment. I truly believe these appointments set the foundation towards the patient's success and a timely return to normal functional mobility. So my observations through these appointments are that the patients who attend a pre-op appointment are more confident in handling the possible side effects they experience after surgery if they do arise. And because we have spent that one-on-one time with them, they can do those exercises safely and know what they can start right away coming out of surgery. So when I see these patients 2 weeks after surgery, they will typically have a better head start on their return to normal baseline function rather than someone who may not have attended a pre-op appointment, who may have just been given a brochure or a standard handout on exercises and not given the chance to practice or ask further questions about it. And then, so to piggyback off that, one specific group of patients that benefits the most from the pre-op patients I see are the breast cancer, but possibly even more is our head and neck cancer patients. Would you agree with that, Darrell?
Oh, absolutely, absolutely. And we used to have an amazing program for pre-op head and neck prior to COVID, and unfortunately, it hasn't been running the same way since COVID. We are really trying to get back to that, but it's just the patient's knowledge to know what's coming next really makes a big difference. Unfortunately, if they go and have surgery and they don't know what to do any better, and perhaps they will receive home care from PT, but many times home care is, can you move from point A to point B being safe? And they usually don't have any problems moving. All the troublesome is their neck, their lymphedema, their swelling, their jaw mobility, their shoulder mobility. So some of those things really a lot of home health therapists don't really recognize, or they really don't work with those kind of specialties. So for us, like when we saw the patients pre-op, we were able to explain to them all the things that we were able to address. So when we saw them post-op, they were like absolutely in tune right away with it. And then we were able to really improve their condition prior to radiation, when now they come in when they already start radiation. So for 6 weeks, they have not have any therapy at all. And they come in here already with the issues to start radiation right away. That is really creating, more side effects versus us trying to mitigate some of that. So definitely make a big difference. And you're right, when you mention the confidence of the patient, like they know better because we've been explaining it to them what can be happen. So that really make a big difference for sure.
Yeah, so I would see that. I would say a lot in my head and neck cancer patients, like you said, being able to discuss their jaw mobility, their neck, the swelling of their face, impairments they may have due to accessory nerve damage, and telling their caregivers also, like, you may expect this to happen. Here's the tools you need to address that until I see you next time. And the patients that had that came in and they were just more confident. They're like, this is what we experienced. We started this. Now tell me what next. Because we're about to start radiation. And it was just such an asset to the patient. So I really think all patients, if you have the opportunity, request a pre-op appointment from your physician, see if they know someone who can get you in, because it will just set you in a really good spot coming out to return to your normal function.
Exactly. And even sometimes when we see pre-op patients, even for, any like breast, and they don't have their surgery like maybe in 3 weeks, give them still a lot of opportunity to start doing things for themselves, to set themselves better for after surgery there. So they can start, either if they have some lack of mobility on their shoulder, we give them exercises and different, skills to be able to get that range of motion back from where they were hopefully better than before. So when they go to surgery, they will really recover in a much better, manner than if they don't. So definitely, hopefully we can get that back. And like you say, I wish everybody, not just head and neck, not just breast, we should be able to see anybody with lung cancer, with, any organ cancer, anybody, osteosarcomas, anybody pre-op or before any cancer treatments really is going to make much more successful the recovery and the mitigation of those side effects from cancer treatments, for sure.
Yeah. So that would be my first tip, is seek a pre-op appointment. My next tip would be is to create a file for yourself, to have a file that you organize with all the info you've been giving from various doctors and therapists, to have it all in one spot. That way, if you move to a different healthcare system or a different state, wherever you may go in the future, that you're able to provide your new provider with key information. So some information that I commonly look for in the chart of my patient is, what surgeries have they had? How many nodes did they have removed? What was their radiation field? What type of chemotherapy did they have? Things such of that nature, having that in your file to present to the new provider you may go to if they don't have access to your whole chart from another system, is really helpful, because that information will play a role in addressing the side effects that you may have down the road.
Excellent. Very good. Any third tip?
So my third tip would be directly towards exercise and return to function. To set the goals for yourself and right up front, identify barriers you may have to those goals. Try to make solution for each barrier before even encountering them. So my best example is my patient says, I already have a really busy schedule. Now I have all these extra appointments. I won't have any time to add in exercise. So the patient already identified their barrier to completing the goal of exercise is time. So my patient's solution they come up with on their own was incorporating their exercise into the time they spent waiting. So waiting for their doctor's appointments, waiting during chemo. So together, I tailored her program to doing her strengthening exercises in these settings during these waiting periods. So this patient was so successful. She met all of her physical therapy goals, which all can be attributed to her taking the time to find solutions to her barriers before she even started to encounter them. They were specific. The solution was specific to her and specific to her goals. So that would be my advice.
Very good. That's excellent. That's very good. I think that you bring a really, really good point, and we see that happens. I mean, you get diagnosed with cancer and your brain just spins, right? The first thing you're thinking is, I'm going to die, and what's going to happen with my loved ones, right? Kids, husband, wives, whatever is their, their close loved ones. And then you start being thrown into all this information from the physician, right? The surgeons say, this is what you have, and this means that, and this is all this information about, this is the possibility of surgeries, this is the amount of tests we're gonna run, depending of these tests can be these other possibilities, and then the waiting time of like, God, when is this gonna be out of my breast or my neck? If the longer you wait for surgery, this is growing on me, right? So is that anxiety of that waiting time for surgery, and then surgery comes, and then waiting for pathology, and then waiting for the test. So tons of information that many times when the patients go to every appointment, we are great about giving hangouts, but you're right, it's these papers of information one after the other that they're like, I know you gave me this paper, I put it somewhere. So I think that the idea of have them organize and say, yes, this is the papers that the surgeon gave me. This is the paper that rehab gave me. This is the paper from the medical oncologist. So it's not only be able to help them if they just change healthcare systems, but to be able to go and communicate with their families, right? Many times the family is like, so what's happening? What did they say? And they're like, I don't remember what they say, because they've been saying so many things. So it's good to go back to those papers and they're like, well, they gave me this paper to show this, and then they can really start reading more about it in good source of reading, right? Like, don't go to Dr. Google, but go into the American Cancer, Association and all these other good resources when you can read more about it, and then investigate more about it, and then come up with more questions to your healthcare providers. So I think it's a very good idea.
Yeah, and I agree. So sometimes the initial paper you get, you're like, well, I don't have this issue. It's not really relevant to me. So if you stick it in that folder and it becomes relevant to you, you can go back and touch base on it, and even write the phone number of the provider that gave it to you. So if you have that problem later down the road, you can contact and reach out to them and seek further advice.
Yep, absolutely. What will be a common question you find oncology patients have. Could you share some information on today?
Yeah, so a question I actually received the other day from a family friend was, I'm waiting on further testing to schedule my surgery date. What recommendations of exercise do you have? So of course I passed along info to find a local therapist who would do a thorough evaluation, but I said in the meantime, start on posture. We are in a day and age when a lot of people have a forward head and rounded shoulders. This impacts neck and shoulder motion. If you're about to have a surgery that can further impact your head and shoulder motion, starting on posture awareness exercises would be a great place to start until you can get into a physical therapist who will then tailor a specific program to you and towards your needs.
Yeah, that's very good. And the other thing as well that I find a lot of the times is like, is this healthcare provider group better than the other? Should I go to, one place versus the other? And my answer is always go to wherever you feel more comfortable with, but definitely whoever is the place that has a multidisciplinary team. You don't
Yeah.
want to be in a place where it's just the surgical oncologist and then that's it. And then you have to go, into another city to see the radiation. And then they don't really work with any rehab, any rehabilitation provider, or you don't have anybody from the nutritionist standpoint or mental health support. So the more you find a place that has a multidisciplinary system, that they actually get together and they discuss your case and everybody is on the same page and they can get access to your records at any time and everybody knows what's going on, it's going to be so much better. So that's something as well I get asked quite a bit. And I tell them, not necessarily come to us. No, we have a great system like that, but wherever you are, find a place where it has something similar to it. So
I agree. That's an extremely important point.
yeah. What book recommendations do you have for the audience and why?
Yeah, so the book I was thinking of, the one book that comes to mind is for mostly those in healthcare interested in learning more about lymphedema. So the book I recommend would be Lymphedema Management by, I believe it's pronounced Zuther and Norton. That is a great book if you're wanting to learn more about lymphedema, as I find that my patients and when we have students, it's harder to access information about lymphedema online still. It's not as readily available, and this book condenses it all into one book. So it's a good read.
Okay, perfect. And I will put it on the show notes so people can see what book they can look into it. Any podcast recommendations?
I'd say stay tuned to Durley. So your Durley's podcast. You always have great speakers lined up that we could all learn so much from. And I always look forward to hearing who's next.
Awesome. Any other podcasts?
That's about it.
Okay, very good. Excellent. How can people find you?
So I'm at the Outpatient UF Health Physical Therapy Clinic with Durley. You can find me there along with many other amazing providers.
And that's any social media?
Nope.
Okay. Lincoln?
Nope.
Okay. Tara, we need to get you in Lincoln. All right. How can my audience find a physical therapist to help them with their needs during and after treatment?
Yeah, so I think the biggest thing, like you say, like having that team approach with all your doctors involved with it and everyone's able to see each other's charts would be start with your doctor. So the person that you're seeking your cancer care from and see if they recommend a specific clinic that a lot of patients have been to and that they like. I'd say that's where I would start.
Okay. So I have another question for you. So what was different about your oncology internship that may like kind of help you drive into coming in this specialty for your profession? We have, for the audience out there, in physical therapy, we can work in pediatrics, women's health, orthopedics, sports medicine, so many different geriatrics. So we can go into so many directions. So a lot of the students do internships before they graduate, and they have to go to a certain amount of internships and get the opportunity to treat different patients, different population. And then when they graduate, they will kind of like seek for opportunities with things that they kind of enjoy. So what what stood up when you were with me as a student that make you decide to come back into this kind of setting?
So it was truly the patients. I really enjoy working with my patients and helping them through. I see a lot of opportunity to help them through every stage of cancer. And I appreciate all the things that physical therapy offers to returning them to their normal life once it's all done.
Mhm. Very good. Excellent. Yeah. And I think you're right. I've been a PT for like, 33 years, going into 34. And for many years, I did orthopaedics. And when the opportunity for me to do oncology came on board, I was like, I'm not too sure if I want to do that. I really don't know that much about oncology. And the moment I shadow some of my colleagues here, Shannon and I forgot her name, Barbara, I totally fall in love with the patients. You're right. It's like something about the patients that is like, their spirit, they're so grateful. It's just so nice. It's like some of them say, this is kind of like my light in the middle of the darkness. Like I'm looking forward to come here, even though I know my skin is being burned with radiation and I feel terrible going through chemo. But when I come here, I always feel better after I leave. So I think that has been such a great driven. And that's what's part of what motivated me to start this podcast. It's like, what else can we offer to patients and caregivers and healthcare providers to really improve these patients' quality of life, right? To try to really help them out, because it's not just I have cancer and then I went through treatments and then I'm all better, right? You become a cancer survivor with a lot of like fears and testing, and that's always going to be on your head the rest of your life. So it's just really helping that survivorship, like what happened next? What do I do if I have these hot flashes that now, since, these pills are taking me into menopause? And what do I do when I still having a chemo brain? And what do I do when I'm so fatigued still? And how do I do to manage this weight that I keep gaining because my metabolism is being slowed down with these hormone blockers? So it's really nice, has been really amazing, like, having conversations with a lot of different guests like you and other healthcare providers, even patients who are on treatment right now. Is always something I learn from every one of you. And I'm sure it's something that everyone in the audience will learn every time they hear it. So I really appreciate you being here today. That has been really a fun conversation.
Well, thank you for having me, Durley.
Absolutely. Is anything else you want to add before I let you go to the babies?
I think that's it.
Okay.
Thanks.
Thank you. Have a good evening.
Thanks, you too.